Even close colleagues of Senator Joe Lieberman were at a loss today to explain his apparent about-face.
I have no idea.
After all, the proposal to allow younger Americans to buy into Medicare had been crafted specifically as a compromise for Lieberman and other moderates who had opposed a public option. The Connecticut senator has championed the buy-in idea for nearly a decade and reiterated his support just 3 months ago.
What I was proposing was that they have an option to buy into Medicare early.
But this week he suddenly threatened to block the health care bill if it contains a Medicare buy-in, throwing the entire process into disarray yet again.
I'm very disappointed because I thought we had Senator Lieberman's staff in the room. I thought we were going to, during the negotiations, I thought he would go along with it.
What's especially mystifying, senators say, is that Lieberman has historically sided with liberals on domestic issues, even though he became an independent in 2006 after losing his Democratic primary.
No one can understand exactly what Joe's up to with this. There's some people that think he's, that he's grandstanding. There's some people that think he's, kowtowing to the insurance industry.
The industry does have a large presence in Connecticut and gives generously to his campaigns. But Lieberman is hardly the only moderate putting the brakes on the bill. Democratic Senators Mary Landrieu, Blanche Lincoln, and Ben Nelson, who come from conservative states, successfully blocked the public option, even though the other 55 Democrats support it. Nelson is still holding out for stricter anti-abortion language, leading some liberals to complain their agenda is being hijacked by a few.
Does it trouble you that you're going against an overwhelming majority of your caucus?
Well, it's not fun. I said that to my colleagues at the White House. I haven't enjoyed it, but you got to do what you think is right.
So this small group of 4 or so senators has managed successfully to impose their will on the other 530 members of Congress because the changes that they're demanding to the Senate bill will likely have to be made to the House bill, too. Katie?
And Nancy, how does Senator Lieberman explain that he supported allowing people to buy into Medicare as recently as September?
Well, he insisted today that he hasn't flip-flopped, that the Medicare buy-in is something that he supported years ago, back when the economy was better than it is now, and back before there was a health care reform bill like this one that does so many other things to make health insurance affordable for older people.
And meanwhile, Nancy, as you mentioned, there are plenty of Senate Democrats who feel very strongly about a public option. Could their support be lost if there isn't one in the bill?
Well, there are a couple of senators, like Senator Roland Burris of Illinois or Bernie Sanders of Vermont, who said today it would be very difficult for them to support a bill if it doesn't contain a public option. But they stopped short of drawing a line in the sand the way that Senator Joe Lieberman did, so it does look like there is some wiggle room there.
All right, Nancy Cordes on Capitol Hill tonight. Nancy, thank you.